Rochelle Pines is a community comprised of active seniors. And during the COVID-19 pandemic, many residents are in the high-risk category and unwilling or unable to perform errands such as shopping. And that's why a group of volunteers teamed up with Rochelle Pines employees to accept food deliveries and stockpile the goods in their food cupboard.
We have United Way volunteers here today helping our pantry volunteers and our site team receive product from 3 Square and some of our partners, so they'll be ready for pantry operations tomorrow, where residents will obtain fresh fruit, vegetables, shelf-stable food, dairy, proteins, everything they'll need to have food stability for the month.
The volunteer efforts are organized through the Multi-Agency Coordination Center, better known as the MACC. The MACC is physically located at Clark County Fire Station 18 and is a central command and control facility used in the event of emergency management and preparedness. During an actual disaster, this place would be staffed with representatives from government, law enforcement, first responders, utility companies, and many more.
The MACC Center, I'm in the volunteer department, and so we are trying to find volunteers for community and nonprofit agencies that have a need during this time, and so we're really extraordinarily proud of the folks that are giving of their time during this crisis, especially when there's so much angst associated with, not knowing whether or not you're going to return to a job or the health of yourself and your family members. So we really appreciate that folks are still willing to give the gift of their time.
Hundreds of volunteers provide service to the community, including the squad at Rochelle Pines. Their efforts have been greatly appreciated by the residents, especially during the coronavirus crisis.
Over the last few months, the COVID-19 pandemic has really impacted our senior communities because these are folks who are just at a higher risk for contracting the virus. They don't want to necessarily get on public transportation and go grocery shopping, and they don't want to have to go to 2 or 3 different stores to find what they're looking for. And especially with the weather heating up, it's not an ideal situation. So these pantries really provide stability in that they know they're getting fresh food every single week.
And this is our sanitation area. This is our sanitation station right here, where the prints will receive a detergent wash and then a rinse and then a bleach wash and then another rinse, a final rinse.
Across town, another squad of dedicated volunteers are doing their part to provide protective personal equipment to frontline healthcare workers.
This is a transparency paper that we'll punch with a 3-hole punch, and then we'll be able to attach the finished print with the shield to make the face mask for the healthcare workers.
Specifically, high-grade clear face shields and frames. Their vision to give back is made possible by caring and resourceful individuals and 3D printers. Beck Shiramonti is one of those fervent volunteers.
We are a team of volunteers. We all have very different backgrounds and experiences. We all came together. Our common thread was our desire to see our local frontline healthcare workers be protected, be safe, and healthy and supported. So we are bridging the gap between the need and the local 3D printers and their product that can supply the PPE that the healthcare workers are asking for.
The procedure starts off-site with an hours-long, 3-dimensional printing process that creates objects, in this case the frames, by laying down successive layers of plastic. Alex Gao is the owner of Moment 3D.
Our mission of this operation is simple. We want to band together and then bring the community together to produce PPEs for our medical frontline soldiers, to do whatever we can to provide support for them, because they can't fail. And they're there every day battling our battles for us. So we just want to do whatever we can to help.
The 3D printed mask assembly line comes together at the Work in Progress co-working space, which was donated by the business owners, of course.
This is the contact point of the forehead, so we have to make sure that this areas are smooth.
Alex transports all the frames from his printer to his volunteers, who then team up to clean, sterilize, and hang to dry the plastic frames. A clear face shield is attached, and an elastic headband is affixed, ensuring a secure fit. The logistics of bringing together Alex's idea, the materials, office space, and volunteers were organized through the MACC coordinator for this operation, Vicki Wilson.
Essentially, it needs to be assembled in order to be useful for the medical community. And so he reached out because he wanted volunteers to help supply his ultimate goal of having 5,000 shields created for our medical community.
This team of people didn't know each other before the pandemic, but their kindness and commitment to provide PPEs to personnel in hospitals, clinics, and individual dentists and doctors' office is a reminder that we are all in it together in Southern Nevada.
My personal opinion, as a community, we want to help. We want to help each other through this, and our healthcare workers are putting themselves on the front line for us. So if we can give back and support and help them stay safe, it just feels like the right thing to do.